Hello everyone, I'm Nishantini. Today I'm going to talk on contemporary external strategy environment for my assignment of strategy and the global competitive environment. At the end of this presentation, you will be having some ideas on industry background, key drivers and trends in healthcare industry, key uncertainties in healthcare industry, two-dimensional grid and scenario planning, possible scenarios, the most possible scenario. At the end of there are some references are there. At the end of this presentation, the nature and purpose of strategy, strategic analysis, its theoretical underpinnings and implications for marketing will be discussed in detail. At the same time, the complex and current event will be discussed. Analytical tools of strategic and marketing management, synthesis, evaluation, and development of appropriate strategic and marketing options are discussed. The industry background, when we say the industry background, healthcare industry has become everyone part of life. Although the healthcare challenges may vary region to region, the target of the healthcare system is same: to finance and deliver highest possible quality of care to the customers at the lowest cost possible. Nowadays, the healthcare system is focused on value-based care rather than the money-based care. So now the patient-centric healthcare system is open for new entrants. The patient-centric healthcare system are opening the door to the new market entrants, so that are expanding and reshaping the system. So the healthcare system is open for other industries like retail, technology, wellness, and fitness to bring innovative solutions. So health consideration has become every aspect of life. So the need of policy and regulation is very much indicated when we have high technology like artificial intelligence and machine learning is in place. Key drivers and trends were discussed and analyzed based on Pestel and Porter's 5 forces analysis. When we analyze the Pestel, the political part of the Pestel analysis, when we consider the healthcare industry, the government has the more participation rather than private in case of Sri Lanka. So the people who are in healthcare industry should adhere to the rules and regulations of the government. That means state sector. Because more than 75% of the patients are getting treatment in state sector. When we consider the economical analysis, the low budget of allocation and spending on more on curative sector than the preventive sector is observed. Socio-cultural factor is In the healthcare industry, more than the 60% of the healthcare workers are females. So home-based care will be affected when more female participation in healthcare human resources. And the technology, so ICT, the studies show that ICT will improve the healthcare system by nearly 20%. When we consider the environmental part of the pastel, urbanization that leads to less eco-friendly environment. So long-term exposure to toxic pollutions like air, water, or food has become the threats to the people in the country. When we consider the legal part of the pastel, there is no very much state legal regulations on non-communicable diseases or in the health system. And when we consider the quarters 5 forces analysis, rivalry among existing customers and bargaining power of suppliers and the bargaining power of buyers, threat of new entrants, threat of substitute products. When we consider the new entrants of healthcare system, every company has learned to become a healthcare company too, as safeguarding their customers and employees is their core requirement in continuing business. And there is no big barriers or easy entry in the market. Number and size of market will be expanded in short time. When we consider the customers will have more choices to satisfy their needs. Then while the quality product will capture the market. At the same time, traditional products will lose their reputation. At the same time, customers expect to get quality product with low cost. So the sector is placing great emphasis on preventing health solutions and patient-centric care. This giving opportunity to other industries such as telecommunications, technology, retail, wellness, and fitness to bring innovative solutions to chronic disease prevention and management challenges to share the market. According to the pestilent Potter's 5 forces analysis, we have found the three drivers are patients, policymakers, technology, pharmaceuticals, data activation, and government. The key trends are ever-rising chronic diseases and conditions, changes in demographic pattern, depletion of workforce, patient-centric operating models like intelligence services, public-private partnership, precision medicine, and changes in customers' nature. We have found the key uncertainties as well, like high level of security due to increasing technology, policy impact, unexpected epidemics and pandemics, infrastructure challenges from natural disaster, high patient control over the health, as patients nowadays expecting patient-centric care, they want to engage themselves in their treatment, and skilled workforce, distrustful customers, need high accountability, high transparency, and high integrity. Patients now expect high residential care, and high preventive care is much more indicated nowadays in the health sector. According to the key trends and drivers, two-dimensional grid had developed based on the customer's control over the health and technologies. High technology and high customer control over the health, identified named as Kanye dreams, and high technology and low customer control over the health, named as a page from Dr. Abhi's diary, and low technology and low customer control over the health, named as disappeared page. High customer control over the health and low technology, named as a story to remember. All four scenarios described in our notes detailed and will be discussed in a short form in this presentation. First, Kani's dream scenario. Second one is a page from Dr. Abhi's diaries, disappeared page, and a story to remember. Kani's dream scenario is described as Dr. Kani is writing a letter to his dear friend John about her working station and the customers she receiving at her work. It's like she has written about their working stations to her friend John about how she is working in her hospital. The health focus on preventive medicine, research across the medicine, social care, and environmental health, which give many good health outcomes, and every key trend from biotechnology, smart medicine to genomic technology, gene editing, virtual and augmented reality, smart cities, digital twins, wearable technology, 3D printing, and robotics have a big role in providing intelligent health services. She is providing the healthcare system using the help of the machine vision in providing appropriate care to reduce the maternal mortality by giving exact figure of blood loss during the childbirth, and genomic medicine is used to determine personalized treatment plans and critical care of her patients. And she prescribed personalized medicine using gene editing technology to the conditions like cystic fibrosis and cancers. And how the 3D printing in healthcare is helpful in replicating patient-specific organs, and it make it easier to cost-effectively develop comfortable prosthetic limbs for patients. Above all, she has mentioned about the customers she usually get. Patients who are attending to get treatment are very much empowered. They want to engage in their treatment plans. They are so much concerned about their diet pattern and doing physical exercise regularly. They concentrate more on preventive illnesses rather than getting treatment in a hospital. They come to hospital for checkups according to the appointments and physician's advice. As not like before, she has mentioned about the experience which she had before, like she still remembers her grandma never liked to go to hospital. It may be afraid to go to hospital or bad experiences in the past. So she has mentioned more about how people change with time and how technology had changed the people too. At the end, at the end, she has written and mentioned she is very happy and proud. I was able to save people life with their high technology and their engagement. Her dream has come true, and she has finished her letter like that. A page from Dr. Abby's diaries is a scenario is with a high technology and customers with low control over their health. A page from Dr. Abby's diary scenario, the page is written is like 19th of February 2035 year, Tuesday. She has mentioned about her patient, Mrs. Jennifer, a kind-hearted lady is used to come for regular checkup for her medical conditions like hypertension, hyperlipidemia, and diabetes mellitus. But this time she is visiting us nearly after 5 months. Last time with the use of artificial intelligence and machine learning, I was able to diagnose her conditions and anticipate her current and future needs. Personalized medicine were prescribed using genomic technology. As her hospital, Orient Private Limited, mainly focused on providing patient-centric precision medicine for their customers. She always tries to get her views on treatment outcomes. And the team provide the health education using mixed reality in understandable and friendly manner and promote healthy diet habits by following healthy canteen policy in their hospital. But the problem is her customer had no concern about her conditions and her dietary habits. She has on, but the thing is, she had so much trust on the doctor and hospital, the care center. The treatment plan was explained last time very clearly that our team always will be there to help her when she got an emergency, but the prevention is always better than cure. So health diet habits and regular physical exercise are important to keep healthy and active. When doing regular checkup using computer vision scanning, the Dr. Abi could find some abnormalities in neurological and cardiovascular illnesses as all these were done and guessing gave previously. Then she was admitted to the hospital for further management and her diary continues about other details as well. This part of the diary, Dr. Abi's diary, is described here as how the importance of the customers with low customers, the control over their health is how much important, even though we have the high technology to control and identify, diagnose their diseases. The next scenario is a story to remember the scenario is about low technology and high control over their health. This scenario described a person, 32 years old young man living with his parents in a village called Vedio, which is a beautiful island in Jaffna district, northern province in Sri Lanka. He is the agriculture consultant and farmer owning many paddy fields in his place. He has much concern about his health and choose to practice healthy diet habits as they are easily available in his village. He never skipped his daily routine physical exercise. He always followed that promoting wellness and preventing diseases are the best ways to live happily and healthy rather than getting rated for illness. He visits once in 6 month time for regular checkup to his doctor who is working in local hospital where only basic facilities are available. That was the cultivate season. After a hectic day, he came back home. As he felt unwell, he took unrest for some time in the evening. He felt the same ever after taking rest, but he didn't take that as much serious. So he just told his mother, who is 65 years old with a history of diabetes and hypertension for past 10 years, that he felt unwell. And then he just followed some home remedies at his mother's advice and went to the bed. Next day, early morning, he called for help. His parents, as he couldn't tolerate the pain. He was brought to the local hospital with the help of neighbors. Even though he was attended by the doctor immediately, doctor couldn't save his life as there is no land route to transfer him to the city hospital where all the facilities are available with high technology. And there is in the local hospital where no facilities for the early detection of the diseases and to anticipate their current and future needs and to diagnose the disease correctly. Unfortunately, we lost one energetic, educated young man with much concern about his future and health. This is the story to remember to all. The last scenario is disappeared page with low technology and customers with low control of their life. This also, the scenario is about one person. Mr. Arminayagam is 64 years old government servant, retired 4 years back and living alone at home in Akaripattu, which is a village in Batticaloa district, eastern province of Sri Lanka. He could live to his life without any uncertainties by managing all his expenses with his pension. 2 years back, he was diagnosed with diabetic mellitus, dyslipidemia, and hypertension, and he's getting continuous medication from his rural hospital. He never worried about his diet style or need of physical exercise. And he was just following his medical clinic when he got time. He didn't have any idea to consult his doctor about his status of the disease or the effect. Even name of the medication he doesn't know. One day morning, while he was reading daily newspaper, he felt severe chest pain and drooling of saliva from mouth, and he couldn't hold the newspaper. Was difficult to move his legs too. Some hours later, he was able to reach the nearest base hospital with his neighbor's help. Then he was admitted and transferred to the district general hospital, Batticaloa, where many facilities are available by the ambulance for further management, where he was diagnosed as stroke. He was discharged home with medications after 2 weeks of stay in the hospital. The appointment for cardiac surgery was given due to the high patient numbers, and hospital can't afford to keep a stroke patient until he fully recovered. And he struggled to get the physiotherapy services as there are no planned rehabilitation facilities or high technology to provide home-based care while he was at home. Patients take high control over their health is important to prevent diseases and promote wellness, as well as the technology is the same kind of important have to detect and diagnose the diseases early as possible to provide the possible best treatment. We, we have discussed the scenarios about Kani's dream, a page from Dr. Abi's diary, a story to remember, and disappeared page. The key attribute of Kani's dream scenario is private investment and empowered customers are needed. A page from Dr. Abi's diary about public and private partnership and the sedentary lifestyle. A story to remember is about economic but empowered customers. Disappeared page is about cultural factors and education level. When we comparing all these four scenarios, a page from Dr. Abi's diaries is the most possible and possible scenario. When considering the health outcome, it depends on provider and customers as well. Even though we expect better outcome with high technology, when the customers are adapting the sedentary lifestyle, we can't get the best possible outcome. So it is very much important to have adapting the following the healthy lifestyle when there is the high technology is in place. We have the lesson to be learned. The high technology is not enough when the people are not ready to adapt a healthy lifestyle. The references we have used is listed out here, and thank you for listening. Thank you so much.